Good afternoon. I'm Dr. Sheryl Gabram. I'm the Chief Scientific Officer for Georgia Core, and I'm here with Kimberly Michelle Smith to talk about her breast cancer journey and support for clinical trials. I really appreciate you talking virtually to our Disparities Cancer Clinical Trials audience today, and I know your insights will provide key stakeholders at the summit a unique perspective to the challenging issue of clinical trial accrual of minority patients. So Michelle, let's start by telling me your breast cancer journey.
Hi, Dr. Gabram, and thank you for having me. In August of 2021, after getting a second opinion for what had already been a long journey, 6 letters and 2 syllables changed my life. Cancer. At just 36 years old, I was diagnosed with breast cancer. Faced with a turn of events, and after consulting with my team of doctors, in November of 2021, I felt confident with my decision to move forward with a double mastectomy surgery, followed by 4 rounds of intense chemotherapy that all started in January of 2021. In the chemotherapy, I was offered to participate in a clinical trial. Now, I will admit that I was a bit hesitant to participate in the clinical trial at first because I was uncertain and I had a bit of selfishness for my own health. After voicing my concerns with my oncology doctor, an amazing research nurse, I felt comfortable with being a part of a clinical trial that would allow me to discuss the effects of treatments with my medical team.
That's an incredible story. Can you expand a little further why clinical trials are important for minority patients to consider?
Absolutely. Clinical trials are important for patients to consider because it is an important component towards the advancement of medicine. Importantly, it also develops treatments for minorities. Not to mention, in some cases, clinical trials offer patients with treatment options that they may not have had before.
And how do we overcome the skepticism that exists for patients, especially minority patients, when considering clinical trials?
We can overcome the skepticism that exists in patients, especially minorities, by implementing a model that I call the ECCE, Clinical Trial Model for Patients. First, you educate, you connect, communicate, and engage the patient. In that education, offers the patient more insight on their diagnosis and what their treatment option is. The connection part allows the patient to be connected with an amazing research nurse or a team of doctors to further explain to the patient what the clinical trial is all about. Communicate. Allow the patient to be open in their communication. This is an opportunity for the doctor to address the patient's fears. And engage. Engage the patient during the clinical trial. Be sure that doctors, nurses, and research team members follow up with the patient before, during, and after the clinical trial treatment.
Do you have any other take-home messages for our summit participants today?
Absolutely. My take-home message is that prior to starting the treatment and the clinical trial, I was informed that my participation would allow researchers to track the neuropathy in African American women under treatment of Doxetol. I was also informed that current breast cancer treatments for minorities are tailored for white women. I was always taught not to take others' medications or prescriptions. So, I pose a question to you all. The same question I posed myself. Did I take someone else's medication? Was I prescribed someone else's prescription? Perhaps, did I receive the treatment that was for a white woman when clearly I'm an African American woman? I petition all participants to be clear that clinical trials are vital and we must educate, connect, communicate, and engage with as many patients as possible to move forward with the advancement in medication for minorities like me. A minority woman that believe in living a long life of laughter, love, and memories, even after being diagnosed with cancer.
Wow. That was so powerful. Finally, tell me what role Dr. J had in your treatment and your decision about clinical trials.
Dr. J was very instrumental in my decision to participate in a clinical trial. She was very informative. She answered all of my questions. She would sit down with me and illustrate drawings to show me what was going on inside of my body, to the point to where I spoke with her and I said, Dr. J, treat me as your very own loved one. Dr. J, at this point, at this moment, at this day, she's available to me within my fingertips. I can call her, I can text her, and when she gives time, she'll respond to me. So much that Dr. J has become my very own friend.
Thank you so much, Michelle, and I wish you all the best of health, and I really appreciate the message that you shared today and telling your personal story.
Thank you. Have a great day.
You too.
Yes.